Hello, and a very warm welcome to this short talk on dyslexia. Dyslexia is relatively a common condition in kids, and it's basically defined as an unexpected difficulty in reading that is not related to the child's intelligence, his or her chronological age, his grade, educational level, or in adults, even their professional status. So basically, it's not a neurological disorder. It's can be considered as a functional disorder in which there is problem with reading and sometimes even with expressing the read word. So it's difficult for the child to read and then express the words. So the problem is with the comprehension, and then problem could be with the articulation as well. And it runs in the family. Around 50% of the siblings or parents of dyslexic people, they also have got dyslexia. So here, if you look at this diagram, the brain has got 2-3 areas which are basically related with the processing of the speech, or with the processing of the language, and these are the Broca's areas. And then we have got an area in the parieto temporal region, and then we've got a region in the occipital lobe as well. So the Broca area is mainly responsible for articulation, while the area in the parieto-temporal area, that is responsible for word analysis, and the one in the occipital lobe is responsible for the word form. Now, kids or people who have got dyslexia, they usually have got problems with these two areas. So these two areas, they are not working. So this is probably a representation of the brain of a dyslexic child. So you see there is no area which is responsible for the word analysis in the parieto temporal region, and the one in the occipital one. So there's a problem with the word analysis and with the word form, while there's an overactivation, there's a compensatory overactivation of the Broca's area. So what happens is, like words which would be very easy to comprehend for a normal child, like for example the word cat. So if you ask a child that if you remove the word C, what the word would become, so that would be at. But for kids who are dyslexic, it is very difficult for them if you remove one word, because they have got problem to understand. So they feel like from their perspective, their vision is normal. Remember, it's not a problem of vision. Their vision is normal, but what happens is that they feel like the letters are jumbled up. So this cat might seem to be like something like this. So it becomes a bit difficult for them to understand. Similarly, if the word is written, even the common words, like for example, if I use the word fantastic, so this is very easy. A child who has had some education would be able to pronounce this word. But for dyslexic kids, they have got problems. So they have to break down this word into different parts. So they would read it as a fan, a task, a tick. So they have to break it down. So the words are broken down because the figures, they appear jumbled up to them. And again, I told you it's not a visual problem, that their vision is, let's say, faulty, or there is issue with their sight. That's absolutely normal. It's just the perception, because the way these letters, they are perceived in these areas, that is a bit faulty. And I told you that it runs in the family as well. Now, if a child comes who has got dyslexia, it's important to take appropriate history, and it's important to know what pertinent questions you have to ask if a child has got a problem which seems to be dyslexia. So you need to ask the parents, when was the problem first noticed? Obviously, they might have a history of maybe a few weeks, few months, or even years. So you need to ask the parents, when did they first notice that the child had problems with reading? You also ask about their level of education. I told you that as somebody whose education level is quite low, so obviously they would not be able to read the word. So you have to make sure that the education level is not responsible for that. I mean, these kids would be in the higher classes and still they would not be able to read those words which are considered to be normal for that level of education. So you need to ask about the level of education. You also need to ask about what the teachers think about the child, especially in terms of their attention span and increased activity, because some kids who have got attention deficit hyperactivity disorder, they also have got problem with the reading, but that's more of a a functional hyperactive brain, and the kids, because they have got like a they lack in their attention span, so that's why they've got issues with the reading. So you need to ask the teacher if they've got any issues with his attention and with his increased activity or impulsivity, which would go more in favor of ADHD. You also ask about scores at the school, like the examination score, especially in reading, writing, mathematics, because that would give you an idea. Some kids might be particularly weak in a particular subject, so you have to show that that is not accounting for what you might be thinking is as dyslexia. You also ask about the intelligence, because otherwise these kids are intelligent. It's not a problem of intelligence, it's not a problem where the IQ levels would be low, so you have to ask about the IQ levels, and you may have to do a formal IQ test as well. You also have to ask about a complete developmental history to see that the child is not lagging in other domains of development, like gross motor, the fine motor, hearing and speech, and the social domain. You also ask about family history, because dyslexic kids would mostly have a family history of dyslexia as well. You also ask about any chronic disease which might be responsible, because chronic disease may be associated with depression, and obviously that can take its toll as well, and it might lead to these types of things which you might think as dyslexia, but is basically stemming out of a chronic disorder with its all complications. You also ask about if there is a history of frequent absence from the school, and in case if the child is a bit older, like the teenager, something you would also ask about medication use or any substance abuse, because some people who are taking recreational drugs or something, they would have problems with their attention span, they would have problem with the cognition, and when you've got problem with the cognition, you've got problem with the thought process, and you've got problem with analytical skills as well. So obviously reading is another form of analytical skills which would be suffering in that particular case where a child is taking certain type of recreational drugs. Once you have taken the this type of history, then it's very important to do a relevant examination. The relevant examination means you have to do a full developmental and neurological examination, and you have to see if there are any neurological signs and symptoms which might point towards a particular disorder. And I told you that in dyslexic kids, they are otherwise normal. They do not have any neurological disorder, because dyslexia itself is a functional disorder, so it should not be defined by something which is a structural issue of the nervous system, or is accounted by other problems within the nervous system. Now once you have cleared the neurological system that hasn't got any problems, and the history is pointing towards dyslexia, then it comes down to the management plan. Now, remember, there is no cure for dyslexia, but there are certain training programs which basically revolve around like what we call as phonetic awareness. It also focuses on phonics, it also focuses on fluency, it also focuses on vocabulary, it also focuses on reading comprehension, and these types of things. So it's a long-term treatment. It's a long-term plan in which the child is again and again made to go through these drills to increase his vocabulary, to increase his phonics, to increase his comprehensions, and do these types of reading exercises which can minimize the problem. Remember, as I told you, there is no cure, but that can minimize the issue. So in a nutshell, dyslexia is basically a problem of a reading which is not explained by any neurological disorder. It's not explained by educational status. It's not explained by any chronic disease. It's not explained by their grade or their professional status. So thank you for watching this video. If you are new to my channel, remember, please do subscribe to my channel. My name is Dr. Saeed Kazmi, and if you like my videos, please share it with your friends and give me a thumbs up. Have a very good day. Bye bye.